Hey everyone! So today we're going to talk about how to have successful skin-to-skin during C-sections. I'm going to give you 5 tips and 1 bonus tip for healthcare providers. Alright, let's get started. Okay, so if you don't know me, my name is Hope Richards. I have an Instagram called Dr.Breastfeeding, and really I'm just an OBGYN resident who's into teaching myself so that I can teach others. I really believe that we as healthcare providers can do a better job supporting patients, and so I'm here to help that. The reason I picked this topic is because I put a video or a picture of an awesome example of skin-to-skin during a C-section in my stories. Let's take a look at it. It's a beautiful photo, and I want to reference the photographer. There's actually 2 of them, pictures that I'm going to show today. Birth Stories by Alexandria Mooney and Fresh Pine Photos. You guys, these are really cool birth pictures. Birth photographers make the coolest birth pictures, and I love these ones because they're such good examples of skin-to-skin during a C-section. They're like the legit stuff. You don't see that a lot. So let's get started with tip number 1. So tip number 1 is you need to prepare in advance. Just like anything else in your labor process, it's really important to think about, is skin-to-skin during a C-section even possible? Now, I realize that a lot of you are going to tell me, hey, Hope, I'm having a vaginal delivery. That's totally my plan. There's no reason to think I'm going to have a C-section. And I totally get that. And that's true most of the time. And I want people to have vaginal deliveries. They're actually my favorite. And I think for so many reasons, they're so much better for women. But there are a lot of reasons why women need C-sections. Sometimes there's scheduled repeat. Sometimes there's unplanned, unforeseen medical emergencies that happen. So if you are pregnant, you're talking to your healthcare provider at any point about kind of your plan for birth, bring it up. Just be like, hey, if I did have to have a C-section, is skin-to-skin even possible in the OR? If not, maybe your healthcare provider can make it happen for you. Maybe they've never thought about it before. Maybe it's something patients have never asked for because they didn't know it was a thing. Maybe it could be a little change, or maybe it's something they could do for you, even for a few minutes. If you ask in advance, you're probably more likely to have it be a possibility if it's not one already, because people will be able to plan. Just like you're going to plan for your birth, which I know you're going to, you should plan for trying to do skin-to-skin, whether that's a vaginal delivery or a C-section. As a side note, I do want you to know that there are a lot of hospitals in the United States that don't do this. That's why it was so surprising to so many people. I also want you to know that there's really, really cool hospitals that do. So my breastfeeding mentor told me about how she worked at a hospital in California where they had the drape, and then they actually, instead of just having the plastic drape that like drops down so that people can kind of see their baby, like when I hold up the baby so mom can see it, they actually had like a little hole in it so that the baby could be passed sterilely into a sterile blanket from the nurse right onto mom's chest. So baby never went to the warmer, baby never had vital signs taken somewhere else, baby just literally went straight to mom's chest, and then all of the kind of initial warming, resuscitation was done directly on mom's chest. Super cool. That actually brings up an important caveat, which I kind of forgot to tell you. This only really works for like term healthy neonates. So if you're like a preterm delivery, or there's been an emergency, or baby's not doing well, all of these skin-to-skin things are going to go out the window. You're going to think about doing it later. This is like when things are going in a really controlled fashion and baby's doing really well. It happens though, so let's make this happen. Okay, so I think I wrapped that up. Prepare in advance. Tip number 2. Let's look at this photo again and notice she's not wearing a bra. I know, it's incredible. I feel like women are almost always wearing bras because we get used to them. They're pretty comfortable, especially when we're out in public. This poor mama is like pretty much naked in the OR. I'll give her that. It's like an awkward thing. But I find that most surgeons and healthcare providers and nurses and everybody is trying to like keep mama warm and covered, and so really, ideally, the only thing between mom and baby we know is nothing, right? No sports bra. And so that means that mom's got to be prepared. She either needs to have a gown on in this photo. You can see she has like one of those snap-down gowns. Or mom just has nothing. Oftentimes, like in this photo, you can see that mom has like a blanket across her, and then we just like snuggle baby in right underneath. Yay, easy peasy. If you have a sports bra on or something else, it's going to be real hard to get that off, especially during a C-section. All right, so let's move on to tip number 3. Tip number 3. Again, this sounds really basic, but prepare your partner or your support person. If somebody's going to be with you at delivery, with all of the help around in a vaginal delivery, you might not, need as much help getting baby up onto you. Just, it's kind of a less stressful environment in a vaginal birth. In the C-section, you might need the help of your partner. I find that there's so many overwhelming things going on that if they don't know what skin to skin really is beforehand, like maybe you've done research on it, but they haven't, then they're not going to be able to help you, and they might even be nervous about it. I've seen a lot of support people clutching that little baby right next to mom and being like, here you go, mom, you can touch the baby. And I always want to be like, put your baby down, give it to its mom. So anyway, teach the support person, whoever is coming back to the OR, that is totally okay. Let's use another example of how skin to skin should look and what you can teach your partner. So in this photo, you can see that we can easily see baby's face. So we know baby's face isn't like obscured by any clothing, that baby can actually breathe. We can easily see that baby's head's kind of turned to the side. Baby's like really snugged up in between mom's breast tissue. Baby's covered by that warm blanket, has a warm hat on, and it's got other support people involved too. These are all the things we want. And if the support person knows what that's supposed to look like, it's probably going to be easier to let it happen because they actually have a lot of control. The goal is really that the nursery nurse or whoever is like in charge of the baby is doing those vitals, jumping in to take care of like listening to baby, watching that things are going okay, but also just letting that family kind of have their little moment within the bubble of the busy OR. All right, tip number 4 is that I want you to also have your partner think about what skin to skin would look like if you can't do it in the C-section. So that might mean that your support person goes with baby out to the nursery and performs skin to skin. Maybe they're wearing a button-up shirt. Maybe they're doing whatever they need to do so that they can really have that baby up against them, because skin to skin is going to have huge benefits for the baby and the non-gestating parent, to be honest. I think it's really important sometimes if the support person stays with the patient, because maybe the patient needs that extra help kind of finishing the C-section. But most importantly, if you're in a situation where you can't do skin to skin because you're maybe like under general anesthesia, for example, so you're put to sleep, you have the tube down your throat, maybe that means that your partner is, or your support person is doing skin to skin for you and taking advantage of that precious time. All right, so you know what that means. We're on to my final tip, tip number 5. I'm going to say tip number 5 because I think sometimes we get so focused on our goals that we forget that it's okay if things don't work out. So maybe you have this vision in your mind, you have a scheduled C-section, and you've talked to your birth doctor, and you know that you are going to do skin to skin. And all of a sudden you do skin to skin and you feel super nauseated or like really hot. I've seen this before. Babies are like up on moms and they're just like uncomfortable and they feel like they're going to puke on their baby, and then they like don't want baby on them, but they feel bad about it because they've made this big deal out of it. Just don't worry about it so much. Baby can be held by other people. Maybe you have that plan for skin to skin with the support person if you can't do it. Don't feel bad. Again, C-sections are major abdominal surgery. If you don't feel good, maybe you're exhausted from a long labor, take a rest. Don't feel bad if skin to skin's not for you, or if you accomplish it for 1 or 2 minutes and then you're done after that. I think something that always breaks my heart is when we have these goals and we have these plans and we're really trying to help moms do these things to support breastfeeding or lactation, and then they can't do them and we make them feel guilty. I don't want anybody to feel guilty. I want to make sure that you know that tip number 5 is to do what feels best to you. Don't feel stressed or guilty if you can't perform skin to skin. Okay? I see you. I know you feel guilty. Don't feel guilty. All right, now my bonus tip for healthcare providers. Bonus tip for healthcare providers, this is really, I'm kind of looking to all my fellow OB-GYNs and surgeons who deliver babies via C-sections. My tip is that you need to think about the placement of the drape. So I used to put the drape way up here on mom. See how it's like underneath my breast tissue practically? Well, there is no way that a baby could sit right here and that I could like hold the baby. I just never thought about it before. So I moved the drape down so that it's like underneath my umbilicus or the patient's umbilicus. And all of a sudden, mom has all this room and she can like hold baby and like really get in there. Baby has room to be. Honestly, this sounds like the silliest tip, but I didn't realize that it was a problem until one of the nurses told me. My like bonus tip is that I talked to the nursing team and the anesthesia team and was like, hey guys, let's do skin to skin. Let's make this happen. I really want this for our patients. And the nurse was like, well, then move your drape, Hope. And I was like, move my drape? And then she explained, and I had no idea. And so I think that by moving my drape, I've like made this tiny change for me as a surgeon, because I'm not operating up here. I don't need that space. I still have inches above the incision. By moving that drape down, all of a sudden, I was able to do my surgery, patient was able to do skin to skin, and everyone was happy. So get your team involved, get feedback about how to make it work if you're the healthcare provider, and same thing for patients. Get your team involved, figure out how to make it work. Thanks for listening to my first ever YouTube video. If you liked it, click the like button. I think I'm also supposed to tell you to subscribe to my channel. This is brand new to me. Hopefully it'll work out. Maybe you'll love it, maybe you won't. If you love it, let me know so that I make more videos. All right, thanks everyone, and don't forget to follow me on Instagram, Dr.Breastfeeding.